Now let's talk about cisplatin. Cisplatin is the very important heavy metal containing anti-cancer drug. Okay, so because of its heavy metal containing compound, it is called platinum containing compound. Cisplatin is the example of a certain anti-cancer class of drugs which are called platinum containing anti-cancer drugs. So in platinum containing anti-cancer drugs, we have some examples. In that, first example is cisplatin. And next example we have carboplatin. All these compounds are containing platinum in their chemical structure. Another example we have oxaliplatin. And another example what we have, yeah, so these are CCO, cisplatin, carboplatin, and oxaliplatin. These are the best examples of platinum containing anti-cancer drugs. So let's begin platinum containing anti-cancer drugs with cisplatin. So it is a heavy metal complex which is very effective as anti-neoplastic agent. See, if you see the pharmacokinetics, or if you see, first we'll start with the mechanism of action. Cisplatin and carboplatin, all other platins are having same mechanism of action. Okay, so when the drug, always remember, these drugs are given in IV route only. Platinum containing compounds are available in IV route only, because when it is given through oral route, oral bioavailability of heavy metals or oral bioavailability of large compounds, heavy compounds are not absorbed rapidly from GI tract. Okay, so because of their large heavy metal compound, they are not absorbed properly from GI tract. That's why they are available in IV form. Okay, that important point you have to remember. When it is given through IV route, when the drug is given, this particularly cisplatin, it forms highly reactive platinum complexes. Platinum complexes are formed immediately when it is absorbed or when it is entered into the cell. In the neoplastic cell, the platinum containing complexes will go and accumulate in the DNA, and in the DNA, it damages the DNA. Simple. It forms crosslinks and it damages the DNA. Same like other drugs. So these platinum containing heavy metals are also non-cell specific drugs. So what they do, when the drug enters into the cell, it enters into DNA, it forms crosslinks, and it interferes with the DNA repair. Okay, it stops the DNA synthesis, it mismatches the repair, and it causes death of the cell. Simple. Death of the neoplastic cell. This is the very simple mechanism of action of platinum containing compounds. If we see the important points about platinum containing compounds, always remember, first, very, very important point. They are heavy metals. Heavy metals. They are having high protein binding capacity. They have good protein binding capacity. Since their protein binding capacity is very good, they are their duration of action is also very high. Number one. Okay, first point, they are heavy metals. They have good protein binding capacity. Because of that, their duration of action is very high. Another point. Okay, they are concentrated in kidneys, liver, okay, and sometimes in the intestines, and they are concentrated in the testes of males. Okay, as they are concentrated in these tissues, they are very slowly excreted through urine. So if platinum containing compounds are given in larger doses, high concentration of the drug is accumulated in the kidneys, and it causes nephrotoxicity. It damages the kidney, it damages the liver. Okay, it accumulates in the intestines, it accumulates in the testes. And another important point, all heavy metals and drugs which are having uh, more molecular size, they causes neuropathy. They causes nephropathy, and they also causes ototoxicity. Same like aminoglycosides. Remember, aminoglycosides are antibiotics. In that we have amikacin, kanamycin, gentamicin. All these drugs are aminoglycosides. Same aminoglycosides molecular size is also very high. So high molecular size drugs, and they are very polar drugs. When they are given, they has high ability to accumulate in neurons. With that, they causes neuropathy. So platinum containing compounds also accumulates in neurons, and it causes neuropathy. It accumulates in the kidneys and causes nephropathy. It accumulates in the eardrum in the ear, and it causes ototoxicity. It causes deafness in the people. Okay, so neuropathy, nephropathy, ototoxicity. So these are very important points you have to remember about platinum containing compounds. Heavy metals, their proton binding is very high, their duration of action is very high, they are accumulated in the tissues and they cause neuropathy, nephropathy, ototoxicity. Okay, so these are important points. And another very important point is they are highly carcinogenic. If they are given for patients who are having cancer as anti-cancer drugs, they can also induce another cancer. Okay, secondary cancers can be caused due to platinum containing compounds because of their carcinogen property. And they have high teratogenic property. So in pregnancy, they are not suggested. And if patients who are having kidney impairment, in that cases, it is not suggested. And another very important point you have to remember about platinum containing compounds, especially cisplatin. See, I told it causes neuropathy, nephropathy, and ototoxicity. Ototoxicity. Along with this, it causes other adverse effects like it causes electrolyte imbalance. Electrolyte imbalance. See, in lithium, while explaining about lithium is very similar to sodium. That's why what lithium does, lithium will try to increase toxicity, especially when patient is having hyponatremia. Okay, so when patient has hyponatremia, lithium toxicity occurs. In the same way, platinum containing compounds also causes some electrolyte imbalances. It causes hypokalaemia. Hypokalaemia. Hypokalaemia is decreased amount of potassium in the body. Potassium levels are very important. 3.5 to 5.5 milli equivalent per liter is maintained in the body. If potassium level falls less than 3.5, it causes hypokalemia. So platinum containing compounds causes hypokalemia. It causes hypocalcemia. Calcium levels will be decreased in the body. In previous classes, I told 9 to 11 mg per dl is the normal level of calcium. If it is decreasing less than 9 mg per dl, that is called hypocalcemia. And sometimes it also causes hypomagnesaemia. So magnesium concentration also decreases in the body when cisplatin is given. So cisplatin, remember, cisplatin causes nephropathy, neuropathy, ototoxicity, electrolyte imbalance, hypokalemia, hypocalcemia, hypomagnesemia. It is having good protein binding capacity, plasma binding capacity. So it stays in the body for a long period of time. It is not easily excreted from the body. Okay, so these are important points you have to remember about cisplatin. And mechanism already you know. It causes platinum complexes in the cell. It damages the DNA, and through that it decreases the formation of DNA replication. So these are some basic and important points about cisplatin. I think you understood about pyrimidine analogs and about platinum containing compounds, cisplatin. So that's it for today. uh, in tomorrow's lecture, I'll come with few cases which is related to finished topics, as we have discussed all antimetabolite drugs. Okay, all antimetabolite drugs were finished with this lecture. So in antimetabolite drugs, we have folate antagonist, we have purine antagonist, and pyrimidine antagonist. All these things were discussed. Okay, so thank you for watching. We'll continue with the other topics in the next class.